Nobody likes bone marrow biopsies. And I have patients who come into my clinic every week who are asking me what alternatives we have to bone marrow-based testing. My name is Mike Slade. I'm an assistant professor of medicine at the Washington University School of Medicine in St. Louis, Missouri, and I specialize in myeloma and other plasma cell disorders. Myeloma is kind of a unique cancer, and that we actually have a very good tumor marker that we've known about for a long time, which is the antibodies that the plasma cells produce. These are monitored by standard of care tests, but we've realized as therapy has gotten better that we can have patients that respond down to the level where they can't be detected by traditional assays, but there's still differences in patients who are what we call MRD positive or measurable residual disease positive versus negative. The current assays that are approved for this are all based on bone marrow, and if patients want this monitored in a serial fashion, they have to have biopsies performed every 6 months or a year, which are uncomfortable and honestly, inconvenient. It takes people a while to recover from the procedure. So we've been really interested in whether or not we can improve blood-based testing and manage to monitor MRD using that source as opposed to having to do marrows repeatedly. The way EasyM works is that it is a highly sensitive assay which is used to monitor this monoclonal protein produced by myeloma cells at very, very low levels. And the hope is that we can eventually replace bone marrow-based MRD, which is directly looking for the myeloma cells, with this blood-based test, which is looking for the product of the myeloma cells. And the hope is that we can also have the same sort of sensitivity, specificity, and prognostic value with a blood-based test that allows us to avoid bone marrow biopsies in the future. So the study we're talking about today was a collaboration between us and Rapid Novor, where we used bank samples from 130 patients who underwent stem cell transplant. And the question we had is whether the EasyM assay could help us distinguish between patients who would have their myeloma come back very quickly versus patients that it takes a longer period of time for their myeloma to relapse after transplant. And what we found is that the EasyM assay allowed us to distinguish these patients very clearly, honestly, almost as good as bone marrow-based testing. So one very important caveat of the study is this was all patients from a single institution treated with sort of a uniform treatment approach. And an important step, to show that this assay really works in a larger population is to do this in other cohorts. So I think that's certainly the first step. I'd say the second part that we're really looking to in the future is whether or not we can use EasyM and similar assays to guide treatment for patients. The current standard of care after transplant is that we give indefinite maintenance, which has been shown to prolong the time until the disease comes back. However, these drugs are expensive, they can be toxic, they're very inconvenient for patients, and there's probably a subset of them that we could safely stop treatment and simply observe them off therapy. So the hope is that in the future we can use EasyM or similar assays to be able to discontinue treatment safely and then potentially resume treatment when the disease starts to become active again. Still, this needs to be validated in future prospective studies, and some of those are currently in the works. The reality is that patients and providers, nobody likes bone marrow biopsies. And I think the power of MRD is well established at this point. It's a question that patients have, am I MRD negative? And being able to provide them with answers about that without doing a bone marrow-based test, I think is really powerful and really exciting. And I think that's really the hope for the future of these assays.